There are many questions a person living with HIV already has, but it's the latest one doctors are hearing the most. Are these specific patients considered immunocompromised and more at risk of contracting COVID-19? According to Nine Health expert Dr. Payal Kohli, that all depends.
Everyone in HIV cannot be lumped into the same box together, and this needs to be highly personalized when it comes to recommendations with HIV patients and COVID vaccines.
She says individual cases should be looked at for two things. First, CD4 cells, or cells that are involved in fighting infections.
And we see that above a CD4 count of 250, your response is essentially identical to any immunocompetent person. When your CD4 count gets below 250, that's when you really have to worry about potentially getting a booster because you don't have enough of those T cells.
Those are a type of white blood cells that help create an appropriate response to the COVID-19 vaccine. The second factor, a person's viral load.
So how many copies of the HIV virus do you have inside of you? Now, if your viral load is undetectable and your CD4 count is normal, you're essentially immunocompetent. On the other end of the spectrum is a high viral load and a low CD4 count.
And these patients aren't the only ones with questions. Dr. Kohli says now health professionals can learn a thing or two from the scientific response to HIV to help them combat COVID-19.
Because they have lived the life, they have made the lessons that we are now going to follow.
For Mile High Mornings, I'm Jordan Chavez, 9 News.
Jordan, thank you again. Patients with HIV need to consult with their own doctors when it comes to these questions about vaccinations.